Alright, what is up YouTube? This is Ayush Sharma and welcome to Bodybuilding Fitness and Lifestyle. In this video, we are going to continue the Anabolic Steroid series. And this video is part 1 of module 2 where we are going to cover some cardiovascular side effects of anabolics. So without wasting any more time, let's dive into it. The third one is blood pressure. The other two we have covered in the previous video, so you can check that out. Now anabolic steroids elevates the blood pressure. There is a study which shows this effect. A study says that the average blood pressure in a group of steroid user was 140/85, whereas the blood pressure was 125/80 in vegetarian individuals which are not on anabolics. So you can see the difference in blood pressure. Now what are the reasons which increases our blood pressure? So some of these are the water retention or the increased vascular stiffness. Now we will talk more about these two terms in our upcoming videos. Also, increased blood pressure leads to kidney damage. There are a lot of meditations available to control blood pressure, and we will talk about these meditations in some other videos, but if you want to know right away, you can comment it down below and I will tell you. However, this blood pressure tends to normalize once we stop the abuse or once we stop the use of anabolics. So we have to take the precautionary meditations only when we are using anabolics. Now let's see some of the effects of increased blood pressure on our body. So it may result in stroke or vision loss, heart attack or heart failure. Another side effect which we are going to talk about is blood clotting. Anabolic steroid abuse tends to increase the blood clotting ability. So how does it do this? So basically it elevates the levels of thrombin and C-reactive protein, which supports platelet aggregation and formation of blood clots, which may result in strokes in steroid abusers. If you want to know more about this thrombin and C-reactive protein, you can always search this on internet and you will find a lot of information. As per my knowledge, you don't need to go in depth about how this formation takes place. You have to keep in mind that when we take anabolics in high dosages, it tends to increase the blood clotting ability. Now, what are the effects of this? Let's take an example that this is an artery and this is what a blood clot looks like. Now, if this clot that's stuck in arteries of your brain or somewhere, then it might be a serious situation. So you need to avoid the formation of these blood clots. And how do we do that? Let's see it in the upcoming slide. So what people usually do is they remove 1 pint of blood when they are on steroids after every 2 months. When we intake aspirin, it will reduce platelet aggregation and avoids clotting. So you need to be aware of all these situations before you even start thinking about taking anabolics. This blood clotting tendency should return to the normal state after we end our anabolic steroid use. So now if you have any doubt or if you want to ask anything, you can either DM me on Insta or you can comment it down below. If you enjoyed the video or if you learned something from this video, let me know by leaving a thumbs up and a comment below, as this boosts my confidence a lot. By this, Ayush Sharma signs off and have a nice day.